You doing? This is Dr. Richard Busch with CashmasterPractice.com, and I'm here with a real good friend of mine, Dr. Jason Davis. Dr. Jason Davis is one of, in the past, he's been one of the top performers in a cash practice of any type in healthcare. He's actually was able to. We met quite a while ago when he came through the program was called the Busch All Cash Academy then, and we talked about and we went through the DRS protocol. We worked together on how to do that, and he was actually and has actually been one of the most successful chiropractors I've ever met. He's a great guy. He's a great family man, does a great job, and he's got a lot of insight into running a cash practice, the best things that we can do about running a cash practice, and the best ways we can help people. And so what we're going to do today is we're going to talk about some of Dr. Davis's insights here and some of the other things that he's done. But Dr. Davis, why don't you tell us a little bit more about yourself, what you're doing now, and everything else?
Well, thank you for the kind introduction, Dr. Busch. First
My
and
pleasure.
foremost, my name is Dr. Jason Davis. I originally graduated from Bradley University with a degree in biochemistry and chemistry. And I knew I always wanted to help people. I didn't want to do science experiments and research. So I attended Polymer Chiropractic. I graduated in 2002. And I associated in integrative office for about 2.5 years. So with integration, I learned a lot about managing the chronic patient. And really, you had patients that didn't respond to conservative care, just general chiropractic physical therapy. And then they're pretty much put on drugs and just kind of managed with medication. And ultimately, at that time, I knew there was other options, more sophisticated techniques to treat and manage patients. And at that time, and I would say 2003 or so, I started getting exposed to spinal decompression therapy, non-surgical care for very, very chronic cases, herniated discs, degenerative discs, spinal stenosis, and post-surgical pain. So I opened a chiropractic practice, and lo and behold, soon after that, I met Dr. Richard Busch at a conference, and I was intrigued about the cash approach. And I was in a unique situation. I practiced in Central Florida. It was just pure Medicare. And Medicare, for some reason, lost my application. So I really only had one choice: master cash, if I wanted income. So I attended Busch's All Cash Academy. I learned about handling the chronic pain patient, managing patients for outcome, and using very sophisticated techniques to get results. We utilized the DRS protocol to handle lots of degenerative disc cases, hernia disc cases, and over about, if not half, well over 30% of my cases were failed back and neck surgery cases. So when you're dealing with that particular patient, one, they're disgusted by everything they have attempted that hasn't worked, and they want results. They want trust. They want somebody they can connect to, somebody that can manage the case very, very closely, be very confident in their consultation exam skills, and manage improvement as it comes along and guide them along the way to show them the improvement they're getting with the techniques and equipment that we're using. So we managed decompression cases, neuropathy cases, and really chronic peripheral joint conditions, knees, hips, shoulders with high power laser therapy. Is that what you're looking for, Dr. Busch, for an introduction?
Well, I'll tell you what, it's a fantastic introduction because those are all, it's amazing what I saw you do in practice. And, one of the things I like best about what we're doing from a cash practice and cash management standpoint, as far as patients, is the fact that we get better results than they ever get in the medical field as a whole. And the reason for that is because we actually have the patient make a tangible investment in their care. And as soon as they do that, they actually begin to get better, which is really amazing to see. And it's one of the reasons that we've been able to do so well in my office, and I know in your office as well. And I'd forgotten about the fact that that Medicare lost your application. I can't even believe that. That had to have been scary as heck.
Well, it was scary, but you find resources.
Right.
And you optimize those resources.
Right.
And that's what we did. And, in the big scheme of things, it was a blessing in disguise because we learned how to manage cash very, very well.
No, right.
And we never, ever depended on insurance.
Mm-hmm. Well, one of the things that I like to talk about is, the philosophy of cash practice is, I think, so much different than the philosophy of just a regular insurance-based practice. And part of that's because in an insurance model, you actually have to ask some nurse in Idaho whether you can have permission to treat a patient. And then as you start to get them better, you have to stop treating them, because then you have to ask them again if what you've done already is actually worth it for the patient to continue with care. And
Sure.
so it's kind of nice to not have to ask somebody else for permission to treat those patients, and also make sure that we have the patients on our side. And it's also one of the reasons that I think we get so much better results with these types of patients. Would you agree?
I agree with you 100%. You and the patient are the team against the sickness and the disease. That's
Exactly.
it. There's no outside person governing, challenge, critiquing, and criticizing what the therapy is, what you're doing, what the outcomes and goals are. You've established the goals right from the beginning. Now let's go get them.
I would agree completely. I don't think I could have stated that any better, Doc. The other thing about this is, and this actually goes right along with that, is, once you have the patient involved in their care, they're going to actually follow your treatment recommendations. This isn't a situation where you have to actually, hope that once the patient comes in with a lot of insurance-based practices, first of all, if you're in their book, that says that you're actually able to treat that patient, then they might come in and see you. And then they pretty much come in whenever they want to, if they have pain or not. And then they're gone whenever they want to be. And from this type of a model where we actually put together a treatment plan based on the patient's specific needs, and we actually present that for the patient and make sure that the patient understands that what we're there to do is actually help them get well, not sell them on something. I learned a long time ago, people like to buy things, but they hate to be sold to. And by making sure that we're presenting something or presenting a treatment plan in a not only a non-threatening manner, but also in a manner that's going to make sure that that patient feels the most comfortable about it. And by the time we're all done going over it, if we give them the proper information, it's almost like the only decision that they have is to make the decision to actually get started with care. Would you kind of agree with that?
I agree with you 100%. Their goals for the right patient, the non-insurance based patient, is for you to meet their goals. It's
Exactly.
absolutely silly for them not to be in your office and not have a goal of achieving those goals. That's it. You're on the same team.
Exactly. And, the thing about that is it's not just with the DRS protocol or spinal decompression. This is also with neuropathy. And, you were one of the people who got me involved in neuropathy originally. And I'm so thankful for that, by the way. I can't tell you how much I'm thankful for that, because most of the patients that we see that have disc problems also have some form of neuropathy. And living in the Midwest, and I know where you live down in Florida, there were a lot of patients down there that also had diabetic neuropathy as well.
Yes, agree with you.
So when we start talking about these types of modalities and methods, the funny thing about a cash practice overall is that I think that pretty much any type of medicine can actually fit into a cash model if it's done correctly. Would you agree with that?
Yes, I agree with that. Just turn the magic prism on your presentation there. I actually had one of the CEOs of a local hospital come in as a patient while I was in practice. And it was interesting because, he sat down for the consultation, went through the exam, sat down for the report of findings. And then our financial officer came in and spoke to him about the investment in healthcare for the treatment plan. And he called back and says, I got to tell you, Dr. Davis, this is absolutely wonderful the way that you practice. If only medicine could practice this way, it would eliminate probably 20% of our resources for accounts receivable and billing.
No
if
question.
People do arrangements correctly and upfront, what they pay, what they're going to pay, even if they don't pay it all upfront, which at that time we required that they do, it makes the flow of the office so much better. And him as the CEO, obviously, a lot less headaches. But he pointed that out. I thought that was interesting.
Well, one of the things that I've found with working with these patients, and I'm getting a little bit warm down here, so I'm going to take off my jacket. I just finished with my day in the office. But one of the things that I find very rewarding with this is that, I hear very often when patients come in that, they went to see their surgeon, they went to see their medical doctor, they went to see, whoever. And when we're all finished doing our exams and evaluations, this goes along with what you were talking about, but I kind of want to expand on it a little bit. I know that once you get done doing an exam, or once we get done doing an exam, by the time we're all finished with that exam, the patient they're mesmerized from the standpoint of they've never had an exam done like we do them. They've never, they may have had 1, 2, or 5 surgeries, and they never had anybody even touch them before they actually did the surgery. They may have actually been given epidural injections. They may have had a fusion. They may have had MRIs and X-rays and CTs and myelograms and everything else, but nobody ever actually did a physical exam on them. And nobody ever actually could say and push on something and say, this is where your problem's coming from. And when you can do that, and when you can explain it for the patient in a manner that makes sense to them, and in a manner that when we're all finished going over it all, they can actually say, I understand exactly what you're saying. And I often say, in a world where nothing makes any sense anymore, it's kind of nice for something to make sense, isn't it?
Yes,
And
absolutely.
go ahead. I just wanted to kind of expound on what you're saying because I agree with you completely.
Well, you win the patient in the consult and examination. I always had a saying
You.
in my office when I trained my associates, the best doctor wins. Okay. And
Mm-hmm.
you know what that they've been to 5, 6, 7, 8 other physicians in the area to address and manage this problem.
Yeah.
Now they're in your hands. How well are you going to treat them? If this was your last patient on earth, how well of a consult exam are you going to do? Are you doing a complete chiropractic, neurological, orthopedic based exam where the patient says, my goodness, doctor, I've never had an evaluation like that? You know what you're doing. I feel confident in you working with me. And that's the goal from the get-go. If you can establish that rapport, that connection, okay, and generate that confidence in the patient. And if you can help them, what's the answer going to be? Yes.
Yes.
It's as simple as that.
And that it comes from the exam, the consult, the history, and the way that you present the report of findings. And you happen to be one of the best at that, which I've always been impressed with. And the amazing thing for me is, again, going back to the patients who say, I went to this doctor, I went to that doctor. I know one thing: if they don't take care in my office, when they go someplace else, they know that they're actually in an office that's treating them inferiorly.
I agree with you.
And I know that when they go to that office, they're actually sitting around thinking, you know what? I bet I probably would have gotten better results had I just gone ahead and done what Dr. Busch or what Dr. Davis told me to do.
Well, you know what? That pays tomorrow also, because I could count timeless times where a patient came into me. I gave them that superior examination, consult, and history, and they still have that insurance mindset. So they went to the insurance doctor. And what happens 2, 3 months later? They're back in my office.
Yeah.
And tell me it's a story like this. Well, my husband said I should have stayed with you. He never seen an exam like that.
Mm-hmm.
He never felt confident, comfortable in office than yours. That's why we're back. I said, well, great. We're going to do an evaluation. We're going to see where you're at. And if I can help you, I'm going to tell you. Simple as that.
And the amazing thing about it is when you actually have that kind of control over the situation, where we're taking good control over the patient's situation so that the patient understands, first of all, that we do care about them, that we do know what we're doing. We are going to give them superior treatment. They're going to do every single thing that we ask. Their compliance goes through the roof and their results go through the roof. And you know what? They also all have friends that have problems that are exactly like theirs, and they all refer.
Yeah, you're right.
And when that patient when that patient's referred to you and they've already been through and they know somebody who's been through our program, I can tell you what, they don't have any questions about it when we go over their treatment plan.
No, not at all. And what's interesting is the patients that refer, these are chronic, long-term pain patients. And when you get results with them, they might have friends that try other offices, but then when they see that those offices are not helping them, they're so quick to refer them to yours.
No, there's no question. The other thing about this is, and this is something that when you talk about chronic patients that have had long-term problems, these long-term problems that they've had, they're going to be in some doctor's office. And in many cases, they're going to tell all their friends about their problems anyway. And so the problem that we have is that they're going to be in somebody's office. They might as well be in an office that's going to be able to help them get well. And so that's one of the reasons I've dedicated my life to helping people avoid needless and unnecessary surgeries and needless and unnecessary medications. And that's one of the reasons we've been so successful. And I know that you were as well.
Absolutely. There's a need for it. There's a population for it, and they're searching for you. I mean, let's face it, the majority of well-minded people out there, they want a non-surgical, drug-free approach to their healthcare. They just have to know where to get. And when you sit down and consult with them and they have confidence in you, well, the healing begins with the presence of the right doctor. It just goes from there.
I can't agree with you more, Doc. You know, that Dr. Davis, that's one of the amazing things for me here. And it's one of the reasons I love to talk with you about this so much. You know, we talked a couple of weeks ago about some of the other things that are out there, and you know, and we talk about this a lot in my office, but we also work in the same manner with patients that have knee problems or
Yes,
or carpal tunnel. And
correct.
you know, in most of those cases, their only options really are surgery, and it may be a knee replacement surgery. It may be you know, a surgery to cut the carpal tunnel itself. And if there are methods and manners in which we can actually help those patients avoid those kinds of surgeries, obviously that's always the best goal.
Right, right. And many times when these patients consult surgeons, what do the surgeons tell them? Well, you may be back in my office for a follow-up surgery shortly after. Anytime we cut through tissue, what does your body do? It
Scar
lays
tissue.
down scar tissue. Scar tissue is less malleable and less pliable than healthy tissue. The joint becomes more restrictive. The tissue expands. It presses, nerves and soft tissue and irritates the surrounding area of the surgical site. So many times these patients are going back for repeat debridement surgeries. And if they would have just been made aware of a choice that was non-surgical drug free from the start, you're right. You could have helped those patients avoid the initial surgery.
Yeah, and it is amazing. And or you know, the other problem that we have now are these the medications. I mean, they've made sure that opioids aren't available for most patients. So even patients that do need chronic pain medications don't have them.
Well, that
Good.
should be a huge inflow of patients that need your services. Just
There's no,
knowing that these patients are desperately seeking pain control, it's not available to them.
and the options that they have right now are the pharmaceuticals that aren't even for pain management or for pain control. And in many cases, they have side effects. All these drugs have side effects that are worse than what they're taking them for. And you know, I mean, some of these medications that were derived for or developed for seizures or seizure types of disorders. You know, even some of the antidepressants and those things, they all have problems or all have side effects that are actually a lot worse than what they're taking them for.
Right. Absolutely right. It's amazing how many times patients would come into my office. And I remember distinctly this one particular case where the husband says, she's in so much pain.
Right.
We're fighting all the time. She's irritable. She doesn't sleep.
Hmm.
You know, considering getting a divorce if you can't help her.
Right.
And I remember after the course of 6 to 10 weeks of management, and she came back as a supportive care patient after initial intensive. I remember in the post interview I did with them, because I used to record my patients and ask for their testimonials if they're happy with the care.
Mhm.
And the husband spoke up again. He said, "You know what? You saved our marriage. You saved me from hiring a divorce attorney. I couldn't thank you so much." And the wife was there with a big smile on her face. You're right, because a lot of these folks, when they're on these medications, they're in chronic pain, they do become very, very hypersensitive, irritable, angry, and it affects everybody around them. So
You
I
know,
agree with you.
well, what I very often tell a lot of the patients is, you know, when we see them for their initial exam, you know, I explain to their spouse, you know, I do think that I'm probably going to be able to make your husband nice again. And their wife will always look back at him and go, God, I hope so.
Sure.
And then as we start going through care and we're explaining this, and you know, the neat thing about this is for any type of treatment that we offer. But you know, as they start to get better, it affects not only their interaction with their spouse, but their interaction with the people that they work with, their siblings, their parents. And it changes their not only their overall demeanor, but their communication abilities with everybody around them. It changes their lives, and it re-gives them their quality of life. You know, I think that we get the same types of results with chiropractic by working with these patients in the same manner. And obviously, we talked about the spinal decompression and neuropathy, and really the best thing about this is, and I think I think the best manner in which to handle patients is to make sure that you have a system that you can actually employ, and that system can be rolled out to any type of new modality you decide to add to your office. And I think that it makes it very easy to not only expand, but also to grow very quickly without having to relearn how to do a bunch of things.
Correct.
And
Absolutely. It makes you a better doctor, Because at the end of the course of care, guess what? It's a direct relationship with the patient.
Mhm.
It's not somebody saying, oh, we billed your insurance. Sorry, it didn't work. No, you're fighting tooth and nail to get results for these patients. And it's a very, very strong relationship to get those results.
And I think that's one of the reasons we do get such great results, because the patients understand and they know and they see when we go overboard, when we go over and above what we told the patient we were going to do. Because you know what? All I care about at the bottom line, the bottom line is the results that we get for the patient. And the patients feel that. The nicest thing about this is at the same time is we're working to get these great results, and I think that some people overlook this, but there are some people out there that the only thing that they care about is the financial aspects, is that we do get rewarded very well for the services that we offer for these patients. Money is a receipt for services that are rendered. And I think that's very important to remember, but you're not going to be able to do that for a very long time. You're not going to be able to be rewarded very well for a very long time unless you get great results.
Right.
And so that's one of the reasons that I think that this program works so well for so many people. And it's the reason that I personally think that the future of most medical systems is to get away from the medicines and get away from the surgeries, go to the more conservative care and the more conservative types of treatment that don't need the medications, don't need the surgeries, don't need the drugs, don't need the shots, don't need any of that stuff. And because if you find doctors like you, like me, and like so many doctors that are out there that really, really want to get great results, and they're really, really exceptional clinicians, and they just need to be able to implement something new or something in a manner that doesn't, that they don't have to relearn everything every time they turn around or have to reinvent the wheel. I think that that's one of the ultimate things that we can do for doctors. And so that's one of the reasons I love what I do. And it's also one of the reasons that I think that so many people out there are looking at some of the other alternatives, as far as, like we talked about, like knees, not just the injections and not just the stem cells and everything else, but that stuff all works as well.
Well, I'm in agreement with you. I mean, people, very sophisticated, intelligent people, they are looking for that non-surgical drug-free approach first. I mean, they really are. I mean, I could not tell you how many patients with higher education that would come into our office and they would say, well, I'm here because I don't want a surgery. I'm here because I know the injectables are short-term and they're very limited as far as providing some sort of long-term benefit and stability, strengthening condition of the compromised joint. So, yeah, I mean, people do want these services without a doubt.
I agree. Something else that I do think about, or along with this, is, and it goes back to the rewards for it. As I mentioned, I do think that there are a lot of people out there who are, with everything else going on in the world today, and everybody's kind of concerned about, this, that, or the other thing. I think it's important for people to understand that if you have a service that people are interested in and they believe that you can help them, they're willing to invest in their care. And as far as that's concerned, one of the things that we talk about all the time with people and patients is that there isn't really a limit to what they're willing to pay, as long as they feel it's worth it. But once you cross that threshold, then that can become a problem too.
Sure.
But as we're coming up on the end here, we're getting a little bit close in time. Is there anything that you'd like to talk about or add on to what we've talked about to this point?
Well, I would say something is this for patients or is this more for doctors that are considering going cash?
This is going to be more for doctors that are considering going cash. I actually, if I would love to have you back for just the patient podcast as well, where we can talk more about just the actual treatments that we're offering for patients and some of the things and some of the benefits that we can do. And it's kind of the same type of a format as this, only it's a little bit more directed just towards the types of treatment that we're offering. I don't know if you knew this, but I just finished a research study with the IDD therapy machines from American North American Medical. I can't believe I had trouble with that name, but North American Medical. And one of the things that we started to figure out was that some of the reason that the oscillation in the treatment or on those machines, there's an oscillation procedure, that the secondary oscillation switch on the machine. And one of the reasons that actually works or helps is because of something called mechanotransduction of the cells. And so what happens is, from a mechanical standpoint, those cells, as they're stressed, kind of like a spring would be stressed. I'll send you a copy of the research study a little bit later today, so you can actually have a chance to read it. I was going to do that earlier today, and I forgot. I got busy with patients, but the whole idea behind it is that mechanical stress on those cells actually causes stem cell production, and it starts to stimulate the chemokines, chemokines, and a lot of the other kinases that are actually in the cell, which cause cellular production of stem cells, mesenchymal stem cells that can actually help rebuild the cartilage and the tendons and the ligaments, the muscles, and everything else. And so that's part of the reason that this appears to work, or appears to help people as far as the spinal decompression. So that's something you might be interested in taking a look at.
Yeah, I would, considering that stem cells so prevalent. I'm sure patients would like to know that this is influencing the production of stem cells for a safe, effective outcome in their case. Yeah, that's very interesting.
And along with that, you don't have to break the skin to do it, and which is nice. You don't have to worry about secondary infections and things like that, and we don't have to get the medical community involved in what we're doing as far as treatment. So that's one of the more important things that I think that I've done during the course of the last couple of years. What we did is, I've got a DMX in my office, and we put a big cage over the top of one of those tables, a big aluminum cage, and we put the DMX upside down on top of it, and we recorded patients undergoing treatment. And so we could actually see the difference between patients. We can measure that and look at the difference in the oscillation with the secondary oscillation, as opposed to just a primary oscillation, which means where at the top of the force pattern, it oscillates up and down about 5 pounds. And so we could see the difference in the results with that. And we saw that the results were actually better with a secondary oscillation pattern. So it's kind of cool.
Yeah, it is. I would like to see those DMX videos if you have them on your site, or
I've got, I do have some of them on my site, but I also have some of them on a Google Drive that I'll have to send you at least a link to, so you can take a look at them. And then I'll make sure I get you a copy of the paper later today.
That'd be wonderful.
Yeah. So, and that's something that we will have up on the site. We're in the process of a lot of other things. Most of what we're doing right now is working to help not only patients, but also help the doctors that are out there get better results. And so, and that's really what I've always been about. It's about getting better results, because I know that if we get better results, we're going to financially be rewarded for that. And we're going to make a lot more money that way, helping patients. And so what my ultimate goal has always been is to help as many people as we can avoid needless and unnecessary surgeries and needless and unnecessary medications. And also to make sure that we get the proper information to the patient, so they can make the right decision along the way, and so that they don't feel like they're being pressured ever. And so that they feel like when they're all finished, they have all the information that they need, and that they can just make the right decision one way or the other, whether it's through spinal decompression or the DRS protocol, whether it's through neuropathy, through knees, through chiropractic, through carpal tunnel, even through the nutrition that we do and the weight loss that we do.
You're absolutely right. And what I observed from the All Cash Academy when I was involved with your program is you're leading through education. You're giving these patients the knowledge they need to make an intelligent decision. It's the right decision. So it's a very, very good program from an educational standpoint.
Thank you very much for that, Dr. Davis. Hey, is there anything else you want to add on this today?
No, it's just a delight to speak with you, and I'm happy to.
Well, I was just going to say, first of all, I really appreciate your taking the time with us today. If you're interested out there, either click the link below or go to cashmasterpractice.com. You can actually take a look at some other things there. Like I said, I really appreciate your time today, Dr. Davis. You are fantastic to talk to, as always. I always learn something whenever I speak with you as well. And I really, frankly, I don't speak with you enough. So I want to make sure that we make it a point to do that more frequently. And like I said, I'd also like to make sure that we have you back for just a podcast for our patients, which I do one of those every Friday. And,
sure.
And so we can actually record that and make sure that we get it out to some patients as well.
Well, that's wonderful, Dr. Busch. It's a pleasure speaking with you, and I will look forward to that all patient podcast as well.
Hey, perfect. I tell you what, thank you so much for your time today. Give my best to your family, and I wish you the best in everything you do.
Thank you so much, Dr. Busch. Have a great day.
All right, thanks, you too.